Are you caring for others while working and trying to live your own life? Wondering how to find the time for your own health and happiness? Well, you're in the right place. The Happy Healthy Caregiver podcast, which is part of the Whole Care Network, is the show where real family caregivers share how to be happy and healthy while caring for others. Hello and welcome. I'm your host, Elizabeth Miller. I'm a fellow family caregiver, a care advocate, a professional speaker, author, certified caregiving consultant, and certified senior advisor. If this is your first time listening, thank you for being here. This is a show produced bi-weekly to help family caregivers integrate self-care and caregiving into their lives. Each episode has an accompanying show notes page. If you'd like more detail about the topics, products, and resources we speak about, or you want to see any of the related photos, you'll find the show notes by going to the website happyhealthycaregiver.com, and underneath the podcast menu, click the image or episode number for today's show. Now let's get to it. Let's jump into this episode. Hi, and welcome to today's Caregiver Spotlight with my guest, Tina. We're going to get to that in just a minute, but first I have a couple announcements of my own I want to share. First, I want to ask you, does your company have like employee resource groups for parents and caregivers, maybe those living with disabilities, veterans, and so forth, or a group that prioritizes employee wellness? Well, if so, you might want to let them know that I offer events for webinars and in-person speaking events, and also other things that I can do to help support your company as far as support groups or regular coffee chats and those types of things. I would love to be introduced to the person who's making those decisions at your company. Share my information. I'm going to put my link in the show notes to my Keynote Caregiving page so that they can see, the types of companies that I've worked with and some of the information that I share, and would be delighted to work with your company. So maybe share this podcast episode as a way that it can introduce them and say, hey, I think Elizabeth would be great for our company, and here's why I think so. I appreciate that referral. I'd like to thank our episode sponsor, Crazy Compression. Do you ever feel like your feet and your legs are exhausted by the end of the day, or maybe you've noticed a bit of swelling after sitting or standing for too long? Well, I want to introduce you to Crazy Compression Socks. It's a fun solution to keeping your legs feeling fresh and energized. These aren't just any socks, by the way. They're designed to boost circulation, reduce fatigue, and make a serious style statement. I have a pair with me here today. Crazy Compression Socks. They have top-notch support with bold, fun patterns that let you express your personality, whether you're a nurse, a traveler, an athlete, or a caregiver on your feet all day. These socks are going to change the way you think about comfort. So head over to crazycompression.com, use code HHC20 for 20% off your order, and give your legs the energy that they deserve. I want to talk today about the book that I recently read that I gave 4 out of 5 stars on my Goodreads, and it's called One Summer in Savannah by Tara Shelton Harris. Life is messy and multiple things can be true at the same time. This novel shares how one tragic story ripples through 2 families, and it kind of answers the question, can forgiveness help them forge a way forward? The side note is that Sarah's dad speaking only in poem stanzas was a creative writing style, but it also frustrated me a little bit. I guess that's how we can all feel about our loved ones, habits, and conditions sometimes. Even though I wanted to be tolerant and accepting, I still found it hard. I enjoyed the Savannah setting, especially the cottage. And a quote from the book that I want to share is, forgiveness, I've learned, is like a door. You can open yourself up to it or close yourself off to it at any time. I'm going to link to the Amazon page where you can find out more about this book in the show notes page. And I'll also link to my Goodreads profile so that we can be friends there. My favorite thing that I want to share for this episode is actually an inexpensive product that everyone and anyone can use. I thought it was silly when my daughter introduced me to it and encouraged to make it a part of my daily self-care. Now I'm a believer. It's essentially fancy and healthy spray water. The brand I'm going to recommend is from French skincare company La Roche-Posay. It's their thermal spring water. I use it whenever my face feels dry and tight, like that. And I also incorporate it into my morning and evening skincare routines after I cleanse and before I do my serum and my moisturizer. I recommend keeping a bottle in what I like to refer to as your caregiving self-care tote bag. This grab and go bag that you create will help you seize a self-care moment anywhere. Other things that could be in your self-care tote bag are a healthy snack, a water bottle, magazine, a puzzle book, a deck of cards. You get the idea. Let me know if you try the thermal spring water spray and what you think about it. And of course, I'm going to link to that in the show notes. Let's meet today's caregiver in the spotlight. Dr. Tina Sadarangani is a sandwich generation caregiver and an NYU Assistant Professor who's board certified adult and geriatric nurse practitioner. Even though she's a clinician and has a PhD focused on aging, she still finds navigating our healthcare system difficult as the quarterback of her family's care team. In this episode, we talk about what Dr. Tina would do to improve our healthcare system for family caregivers, her mobile app that helps families better manage a person's day-to-day health needs, what grief relief feels like, why boundaries are game changers for her, and how she got lucky in life. Enjoy the show. Hi, Dr. Tina. Welcome to the Happy Healthy Caregiver podcast.
Thank you so much for having me, Elizabeth. I'm so excited to be here with you.
Absolutely. We're going to dive right into it and get started. I always like to I kind of like to set some intention for the show and get us off on a kind of a good thought process here. And so these are a collection of things that have spoken to me over the years. And I'd love to get your thoughts on this, Dr. Tina. It says, accept what is, let go of what was, and have faith in what will be.
That is such important guidance. And it's funny because I'm sure we're going to talk a lot of aspects of, caregiving today, the things that we want to control, having better management of all the moving parts that is being a caregiver. But I think one of the hardest lessons that I've learned as someone who's cared for my seriously ill father is that you can't control much. And while I love to support caregivers in trying to best control the controllables, the reality is that what I've learned is that the universe has a way of sort of working itself out. And it's really interesting. So I do a lot of this work professionally, but of course, I think the thing that makes me most relevant to be here with you today is the fact that I cared for my seriously ill father who just recently passed away a few months ago.
I'm so sorry, Dr. Tina.
Thank you. Thank you. Yeah, he had a long battle with kidney disease, but really we were able to get him home and healthy and back to peak functional status, which is something I'm super proud of. But it's funny because the day that he passed away, he had actually taken a fall at home and he was okay. But my mother said to me, there's an old Indian folktale about somebody who said, was told by kind of like a genie that they were going to be killed by a lion one day. And so this king who was told he was going to be killed by a lion said, I'm going to kill off all the lions so that, nothing that doesn't happen to me. And then what ended up happening was that he tripped over a statue of a lion and died in this folktale. And so, my mother was telling me this because she wanted to remind me that you can only control so much. And I think it's a good metaphor for the fact that we want to do the best we possibly can for those we love with the information we have at a given time. And if we are doing our absolute best, it is enough. The universe is going to throw curveballs at us and, we want to be prepared to handle them. But I think that's such an important lesson and affirmation to start this with, because it was a big lesson for me.
Same. I think one of the biggest lessons in caregiving for me was learning how to let go and realizing, as a person who wants to kind of control a lot of different things, there is so much out of your control. And my, heart breaks for you and your family as you kind of, figure out what life looks like after dad's passed away.
Yes, thank you. We are, and I think there's a real concept, of this idea of relief, of, you watch somebody suffer so much for so long. And while you grieve and you miss them every second of every day, there is this concept of real relief that you feel that this person is no longer, suffering.
Yeah.
And I think for so many caregivers, also having a loved one whose health is so precarious. I know many of us sandwich generation caregivers, we stare at our phones and we're wondering when the phone rings, is it the school or is it my parents or is it the hospital and what is happening? And so there's a lot of that anxiety that, you do get some relief from that. And I want to normalize that concept because it has been, very challenging, but also there's this feeling of, there are certain things that are not weighing on you in the same way.
It's so true. Did you call it relief? like grief relief? Because
I
people,
cannot coin that term.
I have heard that. Yeah, grief relief, like relief with a G in the front of it,
Yeah.
because that's, I think, a very real feeling for many family caregivers, is that, yes, some things have potentially gotten easier, and you hopefully don't feel guilty about that. It's just giving yourself grace that, you went through like a really difficult season of life while you were juggling all of these things. And a big part of that potentially went away. And so I think it's completely normal to feel relief in the grief phase as well. Talk a little bit about your journey, your caregiving journey. Like what was it that you were doing to help support your family, and what was that like for you as a sandwich generation caregiver who's juggling a lot of competing things?
Yeah, absolutely. So it was a real fascinating study. As I mentioned, my father had been, he was doing perfectly, totally fine. And then he actually in 2021 had a battle with COVID that really ended up causing multiple health issues that were ongoing for many months after that. Issues that, really compromised his function. He wasn't himself. It took us many months and many specialists to get to the bottom of what was going on. And I think by that point, there had been significant damage to his kidneys, and he ended up with end-stage kidney disease. And that's all to say that there was a lot of hospitalizations, in and outs, short-term rehab stays, falls, doctor's visits, all the things that all of us as caregivers do and deal with on a day-to-day basis, regardless of what illness it is that we are contending with. I think what's super interesting about my journey, or what has been a journey of self-reflection for me, is that I'm actually a nurse practitioner who really specializes in geriatrics and in the care of older adults. So clinically, you can say I know what I'm doing, but this experience really opened my and my mother, who was also serving as a caregiver to him. My mother's a physician, to both of us around how do people who don't have healthcare backgrounds do this? Because we do. I have loads of degrees and a lot of training, and I don't think any of them prepared me to sit on the other side of the table as a caregiver and to receive sort of, these orders that we get from clinicians around manage his medications, watch his diet, go take him to see the neurologist and the cardiologist and the nephrologist, and make sure you're keeping track and telling me what everyone says, and monitor his weight and monitor his blood pressure. So there's so many moving parts to juggle and to manage. And we wanted my father to get optimal care. I always say for all of us, we want our loved ones to get optimal, not usual care. And I think it was really eye-opening to see how challenging it is to get that level of care for the people we love in a system that's very fragmented, very complicated, and difficult to navigate, especially when you're caring for somebody whose health is so precarious. So
Yeah.
that's really how my journey sort of evolved. And then that experience, though, given how eye-opening it was, it really inspired me to create tools and solutions for caregivers like me who are in that boat to really bridge that gap between clinical care and family caregivers.
Amazing. Yeah, I want to kind of unpack that a little bit, because like, yeah, you should have all the answers typically, or we would think that, you're in the healthcare system. What was something that you may have believed or learned differently, and then once you experienced it, firsthand, we're like, "Oh, no, this is way different."
Yeah, I think I potentially overestimated clinicians' ability to communicate with one another in a manner that was timely, and that I really overestimated their ability to be on top of everything. I think that was the eye-opening thing
Like
about this.
believing they were all talking to each other,
Correct.
and that you were probably not the nucleus as the family of like keeping it all straight. Yeah.
Right. So that I think was the big revelation, was that I was the quarterback of this care team. And that's what everybody needs when they're that seriously ill. You need a quarterback. That's what you
Mhm.
need in a caregiver, is somebody who's going to organize all these moving parts, call the plays, get what you need before, and think 5 steps ahead. And I think that was really one of the biggest challenges we faced, was that, especially when you have something like kidney disease, it affects all parts of your body, right? So it's affecting your heart, it's affecting your brain, it's affecting your physical function. He had an outstanding geriatrician, who unlike many doctors, let us call her on her phone, and allowed us to maintain an open line of communication with
Mm.
her. She was very skilled, and she was trained in palliative medicine as well and in geriatrics. So I think we had the best possible people. I just think that even when you have the best possible people, the key takeaway is that the system is so flawed, that it still relies on you to be the go-between amongst all these individuals. And if you can, I think the key takeaway for me was that if I could bring back the data and the information, these amazing providers could make really good decisions with us. And I
Mm.
say with us, not for us, but with us, and we could
Like
work together
yeah,
together.
you're all part of the team. It's so interesting. Plus all the emotions that go in when we're caregiving. Like we're not just talking about like doing, our day jobs here and blocking and tackling lessons. These are people we care about. And so the emotion part of it. And did you feel like in some ways you and your family members also got a diagnosis when your dad got his diagnosis?
What do you mean by that?
Like a diagnosis as if like we see often so many times that family caregivers health and happiness is greatly impacted when they take on this role, and sometimes I feel like we should call it that, like, hey, I see you. I felt very invisible as a caregiver in those settings, like you're just the person who's quarterbacking or project managing, and yet this is also having a direct impact, at least it was for me, on my health and happiness as well, which I almost felt like, hey, we're going to add caregiver stress to your medical rap sheet here for you.
Absolutely. I think there's something really real about caregiver syndrome and the exhaustion and the burnout and the mental load that we're absorbing, and then the ultimate toll that we see. In that period of time, my own mother was diagnosed with
Mm.
cancer with no family history and otherwise healthy person, and we had to manage that amidst all of this, and part of us will always wonder how much the stress and the trauma of all the repeated hospitalizations, the 911 calls, the emergencies that happen to all of us who are caring for really sick people at home,
Yeah.
with the toll that that takes. I find it interesting that you bring this up, and you also mentioned this feeling of invisibility,
Yeah.
and I'll tell you how real this is. So you go to these doctor's appointments, you're sitting there, and you're all have the concern of this individual who's being cared for at the front and centered. Almost every caregiver I talk to, none of them will say, "Oh yeah, my doctor asked me how I'm doing all the time."
Never.
Never, which
Never.
should be really a mandatory screening question in my opinion. And I'll tell you, recently was invited to edit a major textbook that's used by medical schools across the country. And there is a chapter in it that I was invited to edit on geriatric care and the management of the geriatric patient. And what they had told me was that if there's a section highlighted in yellow, it can be deleted to preserve word count. Do you know which one of the sections was
Yeah, the
highlighted?
family
Yeah,
caregiver. Yeah.
exactly,
Communicating
exactly.
with the family caregiver. Oh my goodness. You were like, no,
Nope,
if it's
nope, that's
highlighted in
staying.
pink, it must stay.
It
Yes.
must stay. It must stay.
Oh,
So I think it's really this invisibility is one of the things that was really apparent to me. And not and it's interesting because the same person who is the primary care for my father was also my mother's primary care provider, and I don't really know, even with seeing both of them and seeing them together, that she really put two and two together, or put the whole story together about how and saw my mother and evaluated her care in the lens of all her multiple caregiving
mm,
responsibilities. And so I'm a big believer in, when we deliver healthcare in this country, that we do it through a family and a community centered lens. And when we sit and we ask the caregiver, we don't just ask them how they're doing, but we ask them who's in their village, who's helping them, who's supporting them, and how can we engage all of those people to better support this individual. And I feel that that was truly absent in
mm.
this experience.
So
And
if we
I'm
it
committed to making better.
I love that. So if you're waving your magic wand, and I love that you're like the person who's looking at textbooks and you're in this profession, like you're waving your magic wand, like what does that look like? What are we missing in our healthcare system right now that if you could wave it and say this is going to be different, what would you do?
Ugh, where would I begin?
I know.
Um, I think the first thing is that in the wake of any serious illness or crisis situation that a family is facing, that there's automatically a reflex or a program or training in place that takes the caregiver aside and walks them through these key steps of, these are the boundaries you're going to need to set. These are the things you're going to need to evaluate. This is what you
Gosh.
need to be prepared.
Yes. Yeah.
And let's start with that. Let's leave the hospital or whatever crisis situation we're in, or the doctor's office, with that information, that this is really what the role is going to be like. And these are the things that you are going to need to consider. And that there's going to be someone professional with you at every step of this process, helping you to make that decision. Because what I saw firsthand in this experience is that in healthcare, we've moved away from this model of doctor knows best to what I think is actually a pretty good model of what we call shared clinical decision making, which means that the family member, we should all be engaged, right? You tell me what you think my dad needs, and I'll tell you what the realities are about him actually doing that, whether it's because he's stubborn, whether it's because we can't afford it, whether it's because he just will
Yeah.
never
Because
go
you're
for
the
it.
expert in your dad.
Exactly. Yes. So how can we work together to make better decisions? I think that's an awesome model. The problem is that both parties need to be informed to be advocates in that model. And that's what's really, really challenging in this space, I think, is because as caregivers, most people just inherited this role. They didn't really sign up for it, and no one ever prepared them for it. And there's no extended village to support them in doing so. I firmly believe caregiving should not be the responsibility of an individual or even a family. It really requires an extended village of, neighbors, friends, religious organizations, community organizations that can help support you. And that's what we ultimately really needed.
Yeah. I think it's out there too. Like, I know that was, it's interesting. Like, I might have phrased it a little bit differently, but because I'm not a clinician, but if I wave my magic wand, I honestly just, yeah, wanted to be visible and for someone to say, oh, this is your role. This might suck, but there is support and resources out there. And here are some things that can help, like fast track you to some of the resources, fast track you to a community so that you can feel like you're not like on this care journey all by yourself. Um, and I think there are opportunities to do that. I feel like we spend a lot of time in doctors' offices. We spend a lot of time in hospital situations. I'm like, what if I was flicking the channels and I could see something, care focused there as little video segments or handouts. Like none of that ever existed. It was like, here's how you can better manage your mom's diabetes, or like even sitting down and walking through the stages of like COPD for my mom never happened. Like it was just like a surprise. Everything like, oh, now she's doing this. And then I'm like, what in the world? Like this is a trajectory now that as I meet other people, I'm like, let me just share my experience and what might be to come. So I think it's, we're kind of saying the same thing is like, let's make that person visible. Let's arm them with support and resources so that their health and happiness doesn't decline and that they can be an informed decision maker to help, get the support they need, grow out their village and their community, but have like this parallel path, like a path for a caregiver to go on and a path for the care recipient that then maybe intertwines and goes places together.
Yeah, and I think the key thing that becomes really, if I was to complain, since I'm allowed to, as a
Yeah.
about something that I felt was unfair or really, impacts the experience that I don't want others to feel, is that at times it was, is this person my father or is this person my patient? And when you are, losing somebody you love, you should not have to sacrifice that role. And that's one of the biggest things that frustrates me about a lot of policies now. So it's great. We can pay many states have policies in which family caregivers can get paid to deliver care for their loved ones. And I think it's important because we all know that there's so much economic loss. Many of us quit our jobs to do this full
Yes.
time, and there's a very real economic burden that caregiving places. And so recognizing that and reimburse, if financially providing for it is important. But I almost think it would be better if we could really resource and train and have trusted other people come to assist us. I mean, that's the real dream and the magic wand, because again, this should be done by a village, and just saying, okay, I'll pay you to be the daughter. It's like, no, you're paying me to be the caregiver when I am the daughter, and you're conflating
Right.
two roles. And I think that's really frustrating, especially, having had somebody who ultimately, succumbed to their illness, is that there was a lot of that time where we were looking at this clinically instead of with, in
Yeah.
the context of our true relationship.
So yeah, so it like in your magic wand scenario, like is there like do we have to hire a certain role? Is it like educating people who are already there? Like is it do you think this is like easy to implement?
Is it easy to implement? That is and that is really comes with the lack of resources in our healthcare system and the way that they are currently used, and I think misallocated to other things.
Mm,
So when we talked about this and sitting down with the caregiver and telling them what, it's not just telling them what needs to be done, it's actually helping them do it. When you get home with your father, there's going to be a hospital bed waiting. There's going to be two trained and competent aides who are going to, come every 24 hours to relieve you and work with your family. There's going to be nutritious meals delivered so that you don't have to worry about it. There's going to be a social worker who comes to your house and works with you and your entire family. There's going to be a geriatric care manager who comes to make sure that your father's wishes are being honored. There's going to be a physical therapist that's already arranged to come on these dates, not someone you're fighting with and waiting for pre-authorizations with and trying to
oh,
get in the door.
yes.
It's all of that coordination that falls on the family member, and there technically are case managers and people to do this, but in my experience it's never been that seamless. It's always my phone that's ringing with, I'm going to show up at 2 p.m. tomorrow whether you're home or not, and
Yeah.
finding a
In
lot of outside experts too to
in my
help.
experience, we've had to kind of ask for this case manager. Like, where
Yep.
are they? Like this mysterious case. Like I even just found out even on the health and the insurance side, like for I have a brother who's neurodivergent that since my folks are deceased, we share the care for. And we didn't know we could get a case manager on the insurance side to like help us navigate. Like it's just kind of ridiculous. Yeah.
Yes, and you have to find everything and you're digging, and you shouldn't spend so much time digging and finding. It's like you're willing to take this person home, great. We're going to set every single thing up for
Yeah.
you. And your job is just to make sure they're to love them, to care for them in the way that you would, and to continue to enrich your relationship with them. That's really
Yeah, well said. Well said,
the
because it really is in everyone's benefit to do that. Like the person probably likely wants to be at home. We likely want less to, to block and tackle. And we're in our society, the longer that we can keep somebody at home and with that love and that TLC, it's going to save us money in the long run.
Sure. But it's
Yeah.
interesting because I was at a conference last week and somebody pointed out that to become, to get a certificate in cosmetology in the state that she lived in, which I'm blanking on, it may have been Virginia, somebody in cosmetology's training has to get, 7,000 hours of training. To become, a home health aide, it's 175 hours. And so I think there's a lot of burnout. There's not a lot of career promotion. And so getting people who want to support
Yes.
in this role, who are trained to work with families and deliver this care, that was really one of the biggest challenges. I felt like I was an HR manager
Yeah. I mean, it's
time.
to have more value and respect for whether you're a professional caregiver or family caregiver. And I was just when you were saying that, I was like, and the training for a family caregiver, you can be one with 0 hours.
Zero
Like
hours
have
exactly.
at it. Have at it. Oh my gosh, so interesting. So you've learned a lot, and I know that like many of us as family caregivers, you've kind of gathered in, reflected back on your experiences, and want to kind of make it different, make it better for other people. Tell us about, the work that you're doing to impact the space.
Yeah. So, it's funny. All of this kind of happened at the same time. And actually, as I said, I'm a nurse practitioner, but my main job is that I'm an assistant professor at NYU, in their College of Nursing and their School of Medicine. And, I was passionate about geriatrics. As I said, I was studying Alzheimer's disease, and the care of people with dementia. And I really was focused on care that was delivered in adult day programs when all
Okay.
of this started with my father. I saw adult daycare programs as this like unheralded resource for caregivers that we don't use enough. And, having seen
And affordable,
and
somewhat
afford
affordable. Yes.
totally. So
What is
another
an adult day? Like, just in case nobody even knows what that is.
Sure.
What is that?
Yeah. So adult day centers are non-residential facilities. They're located in most communities, across the country. They're not senior centers. Senior centers are for people who are able-bodied, who can drive themselves there and just want to go hang out. Adult day centers are really centers that are designed to deliver supervised care to people with physical impairments, cognitive impairments, chronic conditions. There's a certain criteria, varies from state to state. But these centers operate and will care for people anywhere from 4 to 8 hours a day, anywhere from 2 to 5 days a week, depending on what your, insurance allows. They're primarily covered by Veterans Administration, long-term care insurance, and Medicaid. But they also are more affordable, I would say, than other like nursing homes or other forms of long-term care.
If you want to private pay for them. Yeah.
Correct. So they're approximately, the national average is around $75 a day for that care. And the beauty of these centers is that they really provide socialization and productive engagement and meals and friendship and meaning, which is something that I think all older adults need to buffer the effects of loneliness, which we know are worse than smoking cigarettes. And what I always say from a caregiving perspective, because my first degree was in anthropology, they offer an extended kinship network. They're like your second family without the drama. The staff care for you, you make friendships, they give people a time to sort of, unload and enjoy themselves and be themselves in a different way. So I began studying these centers because I thought of them as a really critical access point for dementia care, but I thought they were understudied. What I found was that what was happening in these centers, the staff are super well trained. So many of them, especially if you're somebody with dementia who might not be able to say, hey, I'm not feeling well today, they would say, Mr. Smith, he's acting really off today. I've seen him the last week. I'm going to call his daughter. It's always the daughter, and say, I'm going to, to come pick him up because I think he might have a urinary tract infection. I want him to get looked at. And what we were seeing was that these centers are super wonderful at helping caregivers identify problems early. And if caregivers could communicate that information correctly to doctors, they can facilitate early intervention.
Because they've seen it. They've seen it among their people over and over again. Whereas we don't know. Like, again, we have 0 hours of experience maybe. So, yeah.
Exactly. And I'll give you an example. They once said there was a gentleman at the center who had dementia. He was asking to go to the bathroom every hour. He was throwing his diaper in the bathroom and becoming agitated. And they called the daughter and said, I think he has a urinary tract infection. He's throwing his diaper. The daughter said, he has dementia. Of course he's throwing his diaper. That's what he does. And they said, no, we see him all the time. We know this isn't his normal. Anyway, they called. Sure enough, that's in fact what it was. And he got treated and it kept him out of the hospital. So what I learned through my research, and this was almost happening simultaneously as my father being ill, which was, I think, somewhat serendipitous in a way now that I look back on it, that I was realizing the amount of load that's placed on caregivers to broker communication across healthcare settings, which is what we started talking about. And so I had grant funding from the National Institutes of Health as part of my research, and I used it to create a completely free caregiver-facing app called CareMobi that allows caregivers to keep track of all this information about a person's day-to-day health, whether it's how they're eating, how they're sleeping, their vital signs, or whether it's their upcoming appointments with what questions to ask, their important health documents, and their medications. Because what I found was that my mother was keeping this information for my father, and she was keeping it in a notebook.
Yeah.
And I said, Mom, if something happens to you tomorrow, I'm not going to know what to ask. And then I would offer, and I would say, let me take Dad today to the doctor. The doctor would start asking me questions. How's he eating at home? When did he last see the cardiologist? When's his next appointment with so-and-so? Did they change his medication dosage? And I would say, I'm not there every single day. So I'm honestly not sure. And so much of what I realized also is that 80% of emergency department visits and hospitalizations are because people don't take their medications as prescribed, and doctors have an accurate list of what's actually being taken at home. So the app was an effort to really take the notebook of superstar caregivers like my mom and digitize it into an app that caregivers could use for free. And on top of it, you could innovatively invite members of your care team. So we created a care team for my dad. My mom invited me, she invited my sister, we invited the home health aide, and everybody could be on the same page about what was going on. So not everyone had to do every single thing, and we could all absorb this load and feel a little bit more comfortable knowing what was taking place and what needed to be done.
Nice.
So CareMobi now is freely available in the App Store. It's funded by the National Institutes of Health. It's a centralized hub for families to track and share information about their loved ones' day-to-day health. And it allows us to intervene early with respect to problems. And if you have home health aides or adult day centers, you can invite them too. And
nice.
the other piece of that is just that I know you can't just stick an app in people's hands because I know what it's like to be a caregiver. And it's annoying to think like somebody's like, oh, you're going to solve my problems by tossing me an app. I know that's not true. And so for that reason, we also created Enlightened Caregiver on social media, on Facebook, on Instagram. It's our handle. And the idea was to not only empower people with this tool, but to invite them to give them information about how to be more proactive in the care of their aging parents, what questions to never leave the doctor's office without asking, what questions to ask when you get a new medication, what to look for in an assisted living facility, signs and symptoms of a UTI, like all these things that you and I talked about that
Yeah.
caregivers unfortunately need to know, but never realize they need to know, and really simplifying it for them so they can work collaboratively.
I love that. I love that. And yeah, I love that you just kind of addressed the elephant in the room and was like, there's an app for that. Yes, but it's not going to be like the panacea to everything. What was it like to kind of get your mom to adopt? So I feel like that's the hardest thing is um, some of the older adults, older generations, like getting them to adopt to technology. What was that like?
So it's so fascinating. I was so surprised. First of all, she was an amazing test user. We have several thousand people in the App Store now who use it on a regular basis. And what's fascinating to me is that most of our users fall between the ages of about 55 and 75. Uh,
Amazing.
I thought was very interesting because I really thought it would be mostly younger kind of sandwich generation caregivers who are so used to using apps. But the interface was intentionally designed to be so simple. And I'll tell you, that wasn't really me. We went through thousands of hours of interviews, multiple rounds of iterations with family caregivers, with primary care providers, with adult day centers, with home health aides, with everybody to say, does this make sense to you? And to not make this app clinical, but to make it more like Facebook or Uber or something else
Mhm.
that people, it's just much more user friendly and people are accustomed to. And so my mom realized, it was inspired by her notebook, but she's what I call a superstar caregiver. I mean, she was really diligent about tracking everything. And I think it really helped us work with the medical team to even ourselves become better at making shared clinical decisions. So when they said, do you want this or this? Or you could do this week, or you could do it next month, it would help us, ask the right questions and come up with the right answers together.
Mm. I'm gonna download it. I'm gonna try. Like but we have an interesting situation with my brother. He's 61 years old. He's a snowbird. He lives half the year in Michigan, half the year in Georgia with my other brother. And I become his primary caregiver when he's down here in Georgia, even though he doesn't live with me. And my sister, up in Michigan. But she's like in the process. He's migrating south for the winter. And, she's sending me copies of his insurance card. She's kind of sending me the updated med list. And I have tried in the past to kind of get the things in some kind of a digitized form. Um, and you've inspired me to try again and just say if this could help us make informed decisions. And I don't know, what are some of the other words? Like how do I get her beyond the notebooks and the uh
Yeah, that we need to collaborate. We need to work as a team, and this will actually simplify things. The second piece is that it's really secure. So I always make the comment that in my family before this, our collaboration was taking place in the family text chain. So there would be like funny memes. And then, by the way, dad's cardiologist said this, and that's not an effective way for us to communicate around this. But this keeps us organized.
yeah.
This keeps us on top of things. And this minimizes the number of communications we have to say, where's dad's insurance card? Oh, I can't find it. No, there's an area in the app for important files. You put it in there. And also, it gives you more transparency and a lens into how your brother is doing in these different places, because environment obviously makes a big difference. And I think it just gets the whole like what I say to my siblings is, I think we all just need to be on the same page.
Absolutely.
And that's what this does. It literally gets everybody on the same page about everything that's going on.
Yeah, because I feel like the data is there, but it's mostly in her, like to your point, like what if something happens to her and those kinds of things. So, and you can't be free. Free is good. I
Praise
love that.
God.
Yeah. Yes, and I love that you have this supportive community, the Enlightened Caregiver. We'll definitely link to that in the show notes. Let's switch gears, Dr. Tina, and talk a little bit about your personal self-care. Like you're juggling kids, NYU, your job, your research, all of that stuff. And yet like your work is important. We need you around. How are you? How were you and how are you like infusing things into your own life?
Yeah, I think the boundary setting was the biggest lesson I learned, and I'm firm on them. And I don't, I think there were times where, you know, my there. Let me pause. I think what I realized is, and I saw firsthand, lesson learned, hindsight 2020, boundaries are super important, and I really continue to establish them. What I've learned as a mother and as a caregiver is that nobody is going to really put you first unless you put yourself first. I also learned that I'm a better mom and a better caregiver and a better daughter and better at my job when I feel good and when my own cup is full. And so I have really been prioritizing, first of all, limiting the time I spend on things that really don't bring me a ton of happiness. I fortunately, I love my job and I love my work. But I really try to prioritize my time, to prioritize my family, but also prioritize myself. So Michelle Obama in her book had written a Becoming, how she used to first put her stuff on the calendar and then put everybody else's. And I've really started to adopt that mentality. Like, I have to go to the gym. That is my thing. It doesn't matter. Nobody gets in the way of that. And if I only have an hour a day and I have to prioritize one thing, it's not going to be cooking dinner for my family. It's going to be taking a walk and connecting with a friend because that's what I've determined,
Mm.
I need, versus like slogging away at things that I really don't bring me happiness, that can be solved in another way through a, frozen dinner for one night, or, ordering pizza. It's fine. It's going to be fine. But I have to, put myself first and set boundaries, not only personal boundaries on my time, but on tasks I will not do, and on, finances, things that I'm willing to cover for my parents, things I'm not. And so these are all the types of boundaries that, I've discussed with my siblings. I'm willing to take this quarterbacking role, which, I think all of us have one person in the family who gets appointed, but there are limits to my responsibilities, and there are limits to my capacity, and there are limits to my role. And I'm trying to make sure that I prioritize the things that bring me great joy, prioritize my family, which will come before anything else, and really prioritizing myself. Everything else, has to be fit into a certain window. And it's hard. It's not easy. And there are
No.
days that it doesn't always work, but overall, that's what I'm trying to do, because I think my sanity for my family, for my kids, for my mom, that's what matters the most.
Yeah, it's got to be with intention. And that was something I had to learn early on, was that I'm not going to find the time. There's no
No.
finding time. You have to create the time. And so a lot of times people ask me what my best self-care tip is, and I say schedule it, because like it's scheduled like you would any wellness visit, for yourself. And that can look like, yeah, it could be physical, but it could be emotional, social, whatever it is that you're needing right now. So how are those boundaries accepted by other people? Like, I'm sure they get tested a lot.
They get tested. And, I think it's been hard to stand firm. I think the other thing that I've really learned in this process that I'm trying to get better at, I wouldn't say I'm like great at it, but I'm getting much better at it, is asking for help, and admitting, what I cannot do. And so that's been a real, there has been pushback, certainly from kids. You're spending too much time on this. You're not here enough. You didn't come to my class for pumpkin painting last week.
Yeah.
It's hard. You cannot be in multiple places. And I like to remind myself that, when my father was living with us, he was very sick and he was very frail. And people ask me, like, what's that like for your kids? And I said, I think it's important to some extent to see me doing this, to see the
Yeah.
care that I'm giving, to see how much I love him and willing to support, but also for me to show them that, you know, I'm one person with a lot of competing responsibilities. My kids are the most important thing in my life. They're not the only thing in my life.
That's
And
right.
so it's important to set expectations and boundaries, because I want them to be able to do the same thing.
Yeah. They're watching. They're always watching. The same as I have two kids that are young adults now, both off the payroll. And, I do think like at the time in those intense caregiving season, it was really hard to feel like needs were being met. But, we had to kind of push back and set boundaries and kind of level set and say, we need you to step up and own these things and do this and that. And I think in the long run, to your point, you're teaching them without telling them, like by observing that how you've been able to, put this balance in your life and infuse the self-care. And so that's the gift that will like keep giving for them forever. Well, on the self-care thread, I want to ask you a couple questions from my book that's just a prompted journal, the Daily Self-Care Journal. It's called Just for You, the Daily Self-Care Journal. How have you been lucky in life, Dr. Tina?
Oh, so many blessings. Like I really cannot even begin to count them. And I think the fact that this was such a reminder that I come into contact with families through my work all the time that are dealing with caregiving challenges that don't have really supportive, loving family dynamics. And I think that's a real privilege and a gift that I had, that we had loving parents, selfless parents who worked very hard, but, were engaged in their as best they could be, despite being immigrants who are trying to make a life for themselves. I think they really did their best. I think I was so blessed to have two grandmothers who lived with me, which I now see as like,
Trading ground for you.
what
Yeah. Yeah.
one of my grandmothers is 104, the other is 100. Both lived in my house. They took care of us growing up so my parents could work. I think their presence, their longevity, their resilience has really, been inspiring to me, and it continues to teach humility and strength, which are values and examples that not everybody gets. So I'm really above all grateful for this communal, loving family structure, which I know for a fact is not a privilege that everyone has.
Right.
And I also know that when, there are challenges, and all of these events have it's not always been, roses and cake. And when we disagree, my brother always says, we're really glad Tina didn't become an accountant, because that would have not been I'm the only one in the field in my family. And so I'm grateful that in that challenging situation, I could really be a help to my family and get us organized and keep us focused. But because I do everything in my career using a family-centered lens. And what I've learned is that family doesn't always have to look like mine. Family can be a lot of different things, and extended people. And if we can bring those people into our village to support us, it's a really wonderful and powerful thing. And for that, I'm truly grateful, because I think that's been fundamental to all of this.
Yeah. Well said. Well said. I also won the jackpot there in the family situation. Um, so when you envision your future, Dr. Tina, what do you see?
Oh, what do I say? Well, that's a big question. Um, I see hope, hope
Good.
for a brighter and better future. I see, when I look to my future, I see my children grown. My children are 12, 9, and 6. And I envision a world in which all of these efforts that people like you and me and so many others are making on behalf of caregivers, that this becomes that magic wand that we talked about, that becomes normal, and that becomes the standard of care and support for people in future generations. That we are, I think there was many people in generations before us that silently did caregiving without complaining. I don't think the phenomenon has changed. And I think many of us are trying to bring voice to the struggle that this caregiving
Right.
with it, and that resonates with almost every single person I talk to. And when we now bring that to the forefront, and we advocate for policies to better support people like us, and we stop calling caregivers the fragile backbone of our healthcare system, which we are right now, the fragile backbone, I hope that we become the strong foundation for better health that, really can achieve better care, because by that point, my kids will be taking care of me, and I really hope it's better experience.
Yeah. Yeah. Let's not have it all be for naught, for sure.
Right.
Amazing. Okay, on a fun note, we'll leave you with this question. It's what's one of your favorite indulgences?
One of my favorite indulgences is sleeping in. And I'm not embarrassed to admit it. I need my sleep. And so on the weekends, there's another good firm boundary, is that my husband knows that weekends are his responsibility in the mornings. And there's nothing I love than the privilege of sleeping an extra hour, and really actually feeling and coming out of bed with this energy to start the day. I think there's been a lot of days, I'm not going to lie, as a caregiver, where I've started the day and not felt particularly motivated or energized, that wake up with a sense of dread of what is this day going to bring. And I think the gift of sleeping in, staying under the cozy covers, having that time for myself, and taking it when I need it is like a real indulgence for me, as someone who's particularly with a 6-year-old who will wake up like a clock at 5 a.m.
Yeah.
Sleeping till 9 is a big indulgence for me.
I love that. I love a slow morning as well. I totally understand that. And I remember the boundary setting with my kids, like, do not come in my room until the first number is 7. Like
Exactly.
it has to
We
be,
do the same.
yeah, it has to be 7. And don't come into my room at either, as a teenager with papers at 9, after 9 p.m. at night, like was my, like, you need to show me your stuff before 9 p.m. at night. Like I'm winding
I'm
down and
done.
going to bed. I'm done. I'm off duty. I used to
I'm
say
off duty.
I'm off duty. So, well, we don't have the kids anymore, but we have that are waking us up, but we do have dogs, and we've got we're caring for an older dog that is getting up at like 4:30 in the morning, and it is rough. And so our system right now is my husband and I are taking turns. Like he gets up one morning. So every other morning, my aura ring is like, what happened to your sleep last night? And I'm like, older
The
dog.
dog.
Yeah.
I'm lobbying my husband for a dog, and he's not ready to, he's already
Yeah.
giving up the weekend so I can sleep. So he's like, we're not there until you can give up that indulgence, which isn't anytime soon.
It's a lot. It's a lot. It's a lot of joy. Yeah, two things can be true at one time for sure.
Right.
Well, I have
Absolutely.
enjoyed, this has been like, a fun conversation, but also like really informative. And I'm excited and hopeful that things are going to change. And I love that there's people like you in this care economy space that are are in it and like helping to change the textbooks and change the narrative. I think that's going to be really critical. I know I'm hopeful that like I want this layers of like the research and the people up here that have the funding and this and that, and then the little carepreneurs and the people who are at the ground level blocking and tackling. Like I'm hoping that we can kind of do more to work together to help solve some of these problems. So keep me in mind if there's something I can help you do to kind of move the needle on some of this stuff.
That would be amazing. And that's really what the effort is going to take. That's the magic wand, is us all working together to move this work forward. So thank you for all you do. And thank you for having me on. I really appreciate it.
Yeah, it's been my pleasure. Thank you.
Thank you.
Thanks for listening to the Happy Healthy Caregiver podcast on the Whole Care Network. I hope this episode provided encouragement and practical tips to infuse into your life. You'll find the show notes and all the resources mentioned at happyhealthycaregiver.com. I also invite you to check out previous episodes of the podcast that you may have missed. If you enjoy the show, be sure to subscribe so you never miss an episode. Ratings and reviews also help others discover the podcast, and sharing with a fellow caregiver is a great way to spread support. Stay connected with me between the episodes by following Happy Healthy Caregiver on your favorite social media platforms, and subscribe to the weekly newsletter where every week I share something happy, healthy, and care related. Just visit happyhealthycaregiver.com to join. Until our next episode, I'm Elizabeth Miller with a reminder to take care of you. Are you still here? Well, it's time for the disclaimer. I am not a medical, legal, or financial professional, and I am not providing medical, financial, or legal advice. If you have questions related to these topics, please seek a qualified professional. I have taken care to spotlight family caregivers and experts, but their opinions are theirs alone. This podcast is copyrighted, and no part can be reproduced without the written permission of Happy Healthy Caregiver, LLC. Thanks again for listening to the Happy Healthy Caregiver podcast on the Whole Care Network.